As the Ebola outbreak rages on, the United Nations is warning that a huge gap remains between the resources required to contain Ebola and what has been mobilized so far. That is both in cash and in kind.
We're facing lots of obstacles. The single greatest one is the mobilization of human resources. On the international side, we need trained medical personnel. We especially need experts who know how to run these facilities, who know how to manage them, who know how to protect the healthcare workers in them from getting sick.
UN Secretary General Ban Ki-moon highlighted the magnitude of the resource deficit when he pointed out last week that the UN kitty had only received $100,000 out of $1 billion sought for the Ebola Trust Fund. According to the UN, $365 million in cash and contributions of resources is registered. Another $204 billion in pledges have been made and are yet to be filled. The latest WHO situation report indicates that Ebola treatment units in the affected countries are currently facing a shortage in bed space. This forces families to care for sick relatives at home, which increases the risk of transmission. WHO says 4,388 beds are required in 50 Ebola treatment units in the 3 affected countries. Only 1,126 are already in place. There is also a gap in the availability of foreign medical teams to manage and staff the treatment centers. Teams have committed to manage 30 treatment units.
The world was not prepared for the outbreak of this virus. West Africa had never had a case of Ebola, and previous outbreaks of Ebola had been generally in very remote, isolated areas, and the world had developed, WHO had developed, national authorities had developed a certain approach to treating those outbreaks, which was 100% successful in the past.
The UN has set a 90-day plan within which to significantly alter the spread of the disease by putting in place capacity to isolate at least 70% of Ebola cases and safely bury at least 70% of patients who die from Ebola by 1 December 2014. The plan would culminate with a 100% isolation of all Ebola cases and 100% safe burial rate for all who succumb to the virus by 1 January 2015. Interventions are, however, falling fast behind the set timelines.
It takes some time, it's going to take a lot of work, it's not going to be easy. Those targets that I just mentioned for December 1 are extremely ambitious, extremely hard to meet.
The UN says the funds and resources will not only help stop the spread of the Ebola virus, but also prevent another outbreak. Carol Oyola, CCTV.